A person in northern Arizona has died after contracting bubonic plague, according to local health authorities. As per NIH, the unidentified patient arrived at the Flagstaff Medical Center Emergency Department and died there the same day. Although the exact date of the death was not disclosed, NIH reported that the patient received appropriate initial management and attempts to provide life-saving resuscitation, but the patient did not recover and died in the emergency department the same day. Rapid diagnostic testing by the health services led to a presumptive diagnosis of Yersinia pestis, the bacterium responsible for the plague. Bubonic plague, infamous for causing millions of deaths in Europe during the Middle Ages, plague is now rare but still appears in the rural western United States each year, as well as in parts of Africa and Asia. The disease is caused by Yersinia pestis and can affect both humans and other mammals. Symptoms of bubonic plague typically develop within 2 to 6 days after exposure and include fever and swollen, painful lymph nodes, most often in the armpit, groin, or neck. The CDC reports that an average of 7 human plague cases are identified annually in the United States, with most cases occurring in northern New Mexico and Arizona. And these cases are not always fatal. Humans usually become infected through the bite of an infected rodent flea or by handling an animal carrying the disease. The illness can be cured effectively if antibiotics are taken early. In their statement, NIH reminded the public that anyone who suspects they are ill with a contagious disease should contact their healthcare provider. If their illness is severe, they should go to the emergency department and immediately ask for a mask to help prevent the spread of disease. And while they access timely and important care, if you see the history of plague was first introduced into the United States in 1900 via rat-infested steamships, with the last urban epidemic occurring in Los Angeles from 1924 to 1925. Since then, the disease has persisted in rural areas of the western US, with over 80% of cases being the bubonic form. Subscribe to our health bulletin today and get valuable insights, science and health. Click here to subscribe and join a community committed to better health.